Hello, and welcome to the training on the Arizona Workers' Compensation Treatment Guidelines. My name is Charles Carpenter, and I am the Program Manager for the Medical Resource here at the Industrial Commission of Arizona. The Medical Resource Office has prepared two separate webinars that provide claim adjusters with information and resources crucial to properly managing claims. There may be a little overlap between the two trainings. However, this one is going to focus on the treatment guidelines. Additionally, this is the first of the two webinars that you should be viewing. So please view this one first and then move on to the one on pre-authorization. The goal today is to improve your knowledge and understanding of the Commission's treatment guidelines. In order to do that, I'm going to review the following. First, I'll talk about the statute specific to the treatment injured workers should receive in the state of Arizona. I'm going to also review the rules that were developed to ensure that injured workers receive appropriate treatment. I'm going to talk about the official disability guidelines, or ODG, as many of us know. I'm going to go into the pre-authorization process. This is going to be brief in this training because my other training is going to go into more detail with the pre-authorization process and what you need to know and what you need to do as a claims adjuster. I'll talk about the administrative peer review process, and finally I'm going to end this by a brief overview of disputes and the disputes that can be done and what you should know about disputes throughout the entire process. Arizona Revised Statute 23-1062A establishes that injured workers should receive treatment that is reasonably required as part of their benefits. The basis of everything we talk about moving forward is this statute and the language in this statute. So, how do you determine what treatment is reasonably required in accordance with the statute? So if you're a healthcare provider, what healthcare or what treatments are considered reasonable? If you're a payer, how do you determine if the treatment an injured worker is receiving should be covered as part of their benefits? So as most of you know, there may be some disagreements between the payers and the providers. Well, let's just be honest. There could be some gray areas in terms of the treatment that injured workers should receive. So in 2012, the Arizona state lawmakers passed House Bill 2368. This bill required the Industrial Commission to develop and implement a process for the use of evidence-based treatment guidelines, where appropriate, to treat injured workers. So basically, the commission, we were mandated by the legislators to provide tools and resources to assist with determining what is reasonable treatment. So the commission developed 12 administrative rules that are published in Title 20, Chapter 5, Article 13 of the Arizona Administrative Code. These rules are what we refer to as the treatment guidelines for the Arizona Workers' Compensation System. The treatment guidelines apply to all body parts and conditions, and realistically what they do is they provide everyone with a resource or a reference, if you will, on what is reasonably required when treating Arizona or injured workers in the state of Arizona. Among other things, the treatment guidelines, 1, prescribe the use of evidence-based medical treatment guidelines as a tool to support clinical decision-making and quality healthcare delivery to injured employees within the context of Arizona's workers' compensation system. Essentially, healthcare providers are expected to utilize those resources that are known to be most effective when treating injured workers. Next, or number 2, adopt the official disability guidelines, or what we refer to as ODG, as the standard reference for evidence-based medicine. Essentially, treatment that is generally recommended, or if it's conditionally recommended and the criteria was met, that treatment is presumed reasonable. So this is a great resource when you're looking at what is considered reasonable and what you can just really sign off on as far as treatment to an injured worker that should be given or is evidence-based. 3. Outline a non-compulsory process for a medical provider or an injured employee to seek pre-authorization from a payer for medical services or treatment. This is what we refer to as the pre-authorization process. And it is non-compulsory because in the state of Arizona, pre-authorization is not required. Next, and number 4, establish an administrative review process to help resolve disputes between medical providers or injured workers and payers. Essentially, this is a peer review that can be done and established by an objective third-party individual, whether the requested treatment or services are considered to be evidence-based or medically reasonable. So this is, again, a process that I'll talk about. I get into more detail on all of these in our pre-authorization process and the other training, but for now, just understand that that is part of the treatment guidelines in the state of Arizona for injured workers. So the last part of the treatment guidelines is to outline the procedures for bringing unresolved disputes to the Industrial Commission for hearing. And again, this is the final dispute phase, and realistically, if it gets to this point, it goes through the 1061J process, and again, I'll go into more detail. So before I go any further, I do want to show you how to navigate to the Medical Resource Office webpage. The first way of doing that is you select the Divisions tab right here. You'll get a pull-down menu, and what you do is you select the Medical Resource Office from that pull-down menu, and that'll take us to our web page. That's where a lot of other resources are for you. I'll talk about that in a second. The easier and quicker way to get to our web page is by selecting the icon there on the right for medical providers. What you'll do is you'll end up on the Medical Resource Office web page. This is just a snippet of our web page. You can see that top row. That's where most of the information you need to know as a claims adjuster is. There's other information on the page, including the webinars page. That's where I provide live trainings to both healthcare providers and payers. I do recommend that you look at those and see if some of them may appeal to you, or that you may be able to get additional knowledge and resources. So anyways, let's talk about this first column on the right, treatment guidelines and information. So in that one, you're going to see links to separate pieces of information, including the actual treatment guidelines, those rules that were established by the commission. There's a link to the Medical Resource Office pre-authorization form, or MRO pre-authorization form. And if you ever need additional instruction, or you forget what needs to happen, you can refer to that page, because it contains all of the instructions for both healthcare providers and payers in terms of the expectations in completing that form. The next column is for the Official Disability Guidelines, or ODG. There are 3 links here. One is to information on ODG. The next link is for a drug formulary, and the final link there takes you directly to their website. It is not maintained by the commission. It is maintained by MCG Health. So those are the 3 links that are important to you. If you select the drug formulary, you'll get this page pop up. So I've taken a little snippet from the drug formulary. There's some medications here that most of you are familiar with. And just really quickly, if you go through the drug formulary, again, you get that off of our web page. It is at no cost. You can access this at any time. But in any case, you go through and you can find medications. So the top one here, tramadol, of course we know that's used on a regular, it's used all the time for injured workers in a lot of pain. It's one of the opioids that's less addictive in terms of its use, and so you may be seeing that. And if you look to the right, the far right of this slide, you see that there's a green Y associated with tramadol. That green Y indicates that yes, it is generally recommended. If you go down a little further, a couple of drugs further, you'll see that tramadol biphasic is a red N. So what does that mean? It means that it's not generally recommended. So really quickly, Y means that it is generally recommended, N means not recommended. N does not mean that it should be denied. Rather, it also, you can say N means that it needs documentation. So the presumption when you have the green Y is that it's correct or that it's reasonable. If it does not, then it's important that you look at the documentation provided by the medical provider, or by the provider, healthcare provider, I should say. You look at that documentation, and based on the documentation, does it establish that it is reasonable for that injured worker? So the presumption is the Y. If it has the N, you need to look at that documentation. So needs documentation. The other link will take you to ODG, to their web page, and I've taken again a little snippet from ODG. This is what it looks like. You can see you have an area to enter a condition. You can enter a lot of different information here, but for purposes of demonstrating what you can do with this, let's just say you enter low back strain. So you'll get another page after that with a bunch of different treatment options. And I've scrolled through and I've gotten to a point where I'm sure most of you have seen both MRI, magnetic resonance imaging for low back conditions. You've seen, massage, you've seen manipulation. That's what chiropractors and osteopathic doctors do, and sometimes physical therapists. So you'll see a lot of your injured workers with low back strains, and they're going to get manipulation. So you can see that. You select link within ODG. You go into another page and you see how it indicates that it's conditionally recommended. So conditionally recommended, again, you look at the criteria and you can see that it's recommended to have 6 initial visits of manipulation or chiropractic treatment or osteopathic treatment, physical therapy, if you will, that if they're doing manipulation in those visits. So you see that 6 visits are considered or presumed to be reasonable, if you will. So again, criteria is met, the initial 6 visits. After that, they need to reevaluate and determine whether or not that treatment is improving their condition and considered medically reasonable. So again, this is a tool. It helps you establish or presume. You get what's presumed to be correct, what's presumed to be evidence-based, and you also get additional information, like let's say it is a more severe sprain. You can see that there are other treatment guidelines for that or options for that. So again, this helps you establish what's presumed to be evidence-based, what's presumed to be reasonable, and also it gives you information when you need to look at the documentation, when you need to look a little further and make a decision as to whether or not it should be considered medically reasonable. All right, so we've talked about the first 2 parts. Number 1, healthcare providers should utilize evidence-based treatment when treating injured workers in Arizona. Number 2 is that we refer to ODG as the standard reference, the treatment that is generally recommended, conditionally recommended, the conditions are met. That's presumed to be correct, presumed to be evidence-based, and as such should be considered part of those benefits. So now let's talk about the pre-authorization really quickly. Again, I'm not going to go into a lot of detail. I want to give you a brief overview so that you understand that this is part of the treatment guidelines. So this is the form. Make sure everyone in your office knows what this form looks like. It's an action item. You need to take action on this form when you receive it in your office. And also, like I said, when you download this form, there are instructions that you can review to help you understand your part in this form. Really quickly, when it comes to denials, if you receive a pre-authorization request, you should not deny any request for pre-authorized treatment solely based on the fact that it's not addressed in ODG. So let's say it's a newer treatment, it's not addressed in ODG. That is not a reason for denial. Rather, it's a reason to look at the documentation. Make sure that the documentation establishes the clinical need or the reasonableness for that treatment. Number 2 is if it is supported by ODG, it should not be denied unless you have a medical professional or a psychological professional who can rebut that presumption. So a couple of things about denial is really important to understand. When you're essentially telling them that that should not be part of your benefits. So you get the pre-authorization form. It is an action item. Let's talk about the next part of the treatment guidelines, and that is the administrative peer review. So if a healthcare provider, or in some cases the injured worker, if they submit a pre-authorization form, they can go to administrative peer review if each of the following criteria or one of the following criteria are met. Number one, if you fail, or if the payer fails to respond within 7 business days to a Section 1 pre-authorization request, it is eligible for peer review. If the payer fails to respond to a reconsideration request in Section 3, and that, by the way, can be submitted by the healthcare provider or the injured worker, then it is eligible for an administrative peer review, again, if you don't respond within 7 business days. If you deny treatment or services requested by a healthcare provider in Section 1 that is supported by ODG, it is eligible for an administrative peer review. Finally, if you deny or partially deny treatment or services in a Section 3 request or the reconsideration request, then it is eligible for a peer review as well. And finally, if you utilize an IME, an independent medical evaluation, at any point during the process, or if treatment is based on an IME, then it is not eligible for an administrative peer review. Again, that's the criteria. We look at that very closely when we get the requests. We make sure that it meets the criteria before we send that off to a peer review. The peer review decision, it's going to indicate whether or not the denial is upheld or overturned, whether it's partially upheld or partially overturned. So it's going to indicate whether or not that treatment is considered reasonable. Finally, the individual who does the peer review is going to indicate the information they reviewed. They're going to give the reason for their decision as well as clinical rationale and the clinical basis. One other thing is that they do reach out to that healthcare provider. They may have a phone call. They're going to make at least 2 attempts to talk to the healthcare provider about this case. They're going to look at they're going to talk it through and see what's best in the case. One thing about the administrative peer review, if it does go to that place or does go to that point in the treatment guidelines, the payer, or the claims adjuster, if you will, is responsible to pay for that administrative peer review. So whatever our contracted rate is with our contractor is what you will pay for that peer review. So one thing, again, very important, make sure you respond in a timely manner when you see that form. One more thing about the peer review is that it is done, our contractor is URAC accredited. The individual who performs the peer review has to have a current license or certification. They have to have practiced within the last 5 years, and they have to be in the same specialty or subspecialty as the person who would normally perform that service. So these are clinicians, if you will, who have experience and understand that at times, yes, we may need to deviate from the treatment guidelines or from evidence-based treatment, but they also understand, whether or not that should be considered medically reasonable. Finally, if it does go through the entire peer review process, you get a decision from the individual who does the peer review. An interested party can dispute the findings of that peer review. So again, if you go through everything, interested parties in the state of Arizona include the injured worker, the employer, the payer or the insurance carrier for the employer, and the industrial commission. In Arizona, healthcare providers are not considered interested parties. So the healthcare provider would not be able to initiate a dispute or a 1061J through the Administrative Law Division. However, you as the payer, if you do have a peer review that you know should not have gone through the way it did, you can dispute the findings of that peer review by filing for a 1061J. It must be in writing, and it must be filed within 10 business days after that decision was made. So again, look for the determinations or the decisions if you do get a notice that a peer review is going to go through. And finally, you'll have to state whether or not you want to participate in the fast track program. Again, be attentive to the pre-authorization form. Make sure that you're looking for it. Make sure that you're responding to it. All of this encompasses the treatment guidelines. So again, in the state of Arizona, injured workers should be getting evidence-based treatment. To determine if it's evidence-based or if it's presumed correct, you can refer to ODG. At times, you may have to refer to the documentation from the healthcare provider to determine whether or not it's medically reasonable, or reasonable, if you will, and also applicable in that situation. Next is there is a pre-authorization process. There is a peer review process, and we do have rules that provide us with the guidelines on when to go through each part of the process. And finally, you can dispute the findings or the determination in a peer review. So that's the training for today. Again, my name is Charles Carpenter. I am the program manager for the Medical Resource Office. Here's the information if you do want to reach out, if you have additional questions, or if you feel that you would like additional training for your office. Please reach out. We're happy to discuss anything if you're having issues or concerns about the treatment guidelines or what should be considered reasonable. Again, that's part of their benefits. And this is a resource that you can utilize when you're looking at the treatment that an injured worker gets. So thank you for your time, and enjoy the rest of your day. And don't forget to take the training on the pre-authorization process. I go into much more detail as to the expectations on both sides for that process. Thank you.